Good afternoon, ladies and gentlemen. I'm Dr. Jaime Estrada, Board Chair of Texas Doctors for Social Responsibility. Welcome to the next segment of our Public Health Conversation series. It is my privilege to introduce Dr. Archie Bleyer, an internationally recognized leader in adolescent and young adult cancer, a dedicated researcher, and a committed activist for the prevention of firearm violence. Today, Dr. Blair turns our attention to a devastating public health crisis, the rising rates of suicide among young people in Texas and across the country. Suicide is now one of the leading causes of death in adolescents and young adults, and the availability of firearms dramatically increases both the risk and the lethality of these tragedies. Through his research and advocacy, Dr. Blair calls on us to confront this crisis with urgency, compassion, and a commitment to change. After Dr. Blair's talk, there'll be a question and answer session. Please send your questions through the chat. And now, please join me in welcoming Dr. Archie Blair. Archie?
Thank you, Jaime. All right, so there we go. Yeah, that's me at the bottom, and let's keep moving forward because we have some time to spend here. All right. The topic is behind the numbers, meaning being as data-driven and as evidence-based as possible to unpack the issue of firearm suicides in the United States and especially in Texas. The issue is suicide, which can be both directions from a firearm. But my personal experience is that not far from where I'm sitting right now, a 12-year-old classmate, in fact, Evan, who's on this attendee list and watching, knows who I'm talking about, and a 14-year-old suicided with their parents' firearm. More about that later if necessary. So it's a personal issue as well. And I wrote in response to this New England Journal review a couple of months ago in July on the motor vehicle crash prevention need in the United States. And you see in bold down here that they introduced the article by saying motor vehicle crashes are the leading cause of death for persons 5 to 29 years of age. So I wrote a article to be submitted to the and was submitted to the New England Journal saying that's incorrect. That in fact, firearms, bullets, kill more 5 to 29-year-olds than any other method in the United States. In fact, it's 23 to 34% greater, and I had it in a figure, than the motor vehicle accidents. And yet the New England Journal published an article that was not entirely correct. Bullets do more than vehicles. Here's the data in that figure 1, and you can see that the motor vehicle traffic accidents decreased and then started to increase after 2010. But firearms increased much more dramatically in 2010, and there's that 24 to 35% difference between the death rate of firearms in the United States in the 5 to 29-year-olds. So this is the same age group as reported in the New England Journal. I've now added to that there was a 43% increase from 2010 with the firearms and only 5% increase with motor vehicle traffic deaths. But I did add subsequently the firearm death rate. And although it's considerably lower than the overall firearm death rate, which includes, of course, homicides and accidents, unintentionals, but if you look at the increase in that group, it was 58% over the same period from 2010. So the issue is not what was reported, and it's got to be redirected to more need for the firearm issue. So to summarize this, since 2010, firearm suicides in 5, and this should say 29-year-olds in the United States have increased far more than any other of the 15 leading causes of death except diabetes. Diabetes went up 61% as opposed to firearm suicide, but all the other causes, the other 14, 13 causes, were much less than 30%. In fact, most of them were stable or even decreased, like cancer. So it's firearm suicides and to some extent diabetes in this age group. We can talk about the diabetes challenge later. All right, here are the 5 of us that are presenting these data today. You can see where we're from, different corners of the United States. And none of us, as musketeers, have a conflict of interest. In fact, we have a definite interest instead of a conflict of. And yes, we've published in JMNA, PLS01, and at the Baker Institute Center for Health Policy several articles since 2001. And so we can refer to those, and I will in a couple instances. So the agenda today is to deal with the diagnosis issue first, to understand the evidence, and then based on the data and the evidence, what to do about changing the trend, the treatment. So let's go back to the data sources, and you will see here that I have multiple needs of sources, including the CDC, Wonder Whiskars, the fatal and non-fatal injury reports, and then, of course, the National Violence Disease Response System. The National Instant Criminal Background Check System, the Giffords Law Center, every town, the American Academy of Pediatrics, the Violence Prevent Policy Center, VPC, and then our prior publications. In addition, I want to focus for the diagnosis issue here on suicide, AYAs, the adolescents and young adults, and specifically within that group, the 10 to 24-year-olds. I will include both handguns, pistols and revolvers, and long gun data. Long guns meaning shotguns and rifles, and assault weapons, although pistols are definitely assault weapons too. We'll come back to that. And yes, I'll include the United States and its individual states and the District of Columbia, but primarily Texas. And then the data is primarily the last 2 years of available final data, not 2024, for which the data are provisional and not yet fully released by the CDC. So we're going to pick the last 2 years of final data, 2022 and 2023, to bring this as up to date as possible. And again, focusing especially on Texas today. We did publish the overall United States data, and because it's we submitted for publication the manuscript on the overall United States national data, and so I can't disclose those data because they're in review, but I can focus on Texas because that wasn't included in the manuscript. Okay, now here's an overall point of view. As of 2019, 2022, I guess that was, I can't see it on the screen, you've had not only school shootings and mass murders, but also this murder-suicide about a year ago on the Rice University campus, and a 21-year-old. Those are gruesome statistics, but the bigger issue, no matter how gruesome this is suicides. In the state of Texas, in those last 2 years available data, 5,341 suicides, 3,532 homicides. Far more suicides than homicides, but homicides get the news. Although the person who killed this student, a junior, first week on campus a year ago, was somebody who then suicided. If we look at the age group from 10 to 24, which I'm going to focus on, the number of home suicides in those 2 years, 22 to 2023, 331 in Texas. The number of school firearm homicides was something less than 13. 13 included some other accidental deaths, so it's probably a single digit. And yet, what gets more attention, the homicides or the suicides? And yet, the suicide rate in home is 25 times more, at least, probably 30 to 35 times more than the school shooting deaths in the 10 to 24-year-olds. So consider that overall perspective. Suicides are really more problematic. Now, why the age of 10 to 24? Well, because, to start with, if we take patient years of life lost, that if somebody dies when they're 10 or 24 years old, they have more years of life left or lost, potential years of life that would have been saved, than, of course, an older person. And here are the data by 5-year intervals, starting at age 10, out to 85, 90 even, and shows that the number of years of life lost by the 10 to 24-year-olds is considerably greater than any age group above that. So we picked 10 to 24 in part because of the years of life lost. There's a higher peak for that age group. They also have the greatest increase. It's where the problem creates much more rapidly. We have to understand why this is occurring more than any other age group. And what happens in that 10 to 24 has a greater effect on the rest of the age range. Another reason is that the number of firearm suicides in that age group, 10 to 24, again in the same 2 years, 2022 to 2023, was greater in Texas than any other age group. It not only had the greatest increase, of course, I mean, there's a couple other potential increases, but in terms of the actual level, the number of suicides in that 10 to 24-year age range was greater at any than any other older age. So we picked 10 to 24 for those reasons, also because it includes the age 18 and 21 that are being debated in terms of the minimum age to purchase and own firearms. There's another reason, and this one's striking to me. Average annual percent change. Oh, AAPC, average annual percent change. You'll see that a few more times. If you take a range of, let's say, years from 2010 to 2023, what is the average annual percent change over each of those years, averaged over every year, not just from the beginning to the end, like I did in an earlier depiction, but the average annual percent change, which is a rigorous statistical metric. In Texas, if we look at, again, the 5-year age intervals, the average percent increase, and there's 1 year, one age range that actually had a decrease, but every other age range is at an increase, but the highest by far is the youngest ages. It's almost inversely proportional out to age 50. But we picked 10 to 24 because these three age groups, 10 to 15, 15 to 20, 25, 20 to 25, are higher and statistically significant, although I haven't shown it here, than any age group above it. So those are the reasons we picked it. Now, given that, what are we going to do about the problem? What are the strategies or potential solutions? I was impressed by the Giffords data. And now we're going to go back to the Giffords Law Center and look at the suicides in that age group, 10 to 24-year-old, by firearm, by bullet, as a function of the grade. F for failure, failed, E for a little better, D, and all the way up to A, according to the Giffords Law Center's evaluation as of 2022 and 2020, as of 2024, for each state's laws to reduce firearm violence. Those that failed, in red here, of which there were 22 states and includes Texas, have this suicide rate in their 10 to 24-year-olds and the statistical significance, much greater than the next grade, E. And if you go from one to the next, you see that every grade level has an improvement, especially when you get to grade A. Big change from B and a statistical significance of 90% confidence to A. What have the A states done to reduce almost 80%, 90% the suicide rate in their states in this age group? Well, let's look at what the F states were recommended to do last year, because they haven't released the 2025 data yet. It depends on the state, but it includes, in order to get out of a failure grade by the Giffords Law Center evaluation, universal background checks, permits to purchase a gun, a waiting period after requesting a purchase, repealing permitless carry, repealing stand your ground, depending on the state, pass an extreme protection order law, ERPO, strengthen domestic violence laws, regulate gun dealers and the gun industry in general with legislation, getting gun dealers to have a state license because some of them didn't, or improve the mental health reporting to understand that background. And finally, to do something across the state to invest in the problem with actual state dollars. So you got all those, but here's what Texas was recommended to do. Well, first, they noticed there was no significant gun legislation passed in 2024, so they got dinged. Texas got dinged. But to improve, to get out of the F range, at least to get to E, raise the age from 18, pass a law banning straw purchases, requiring safe storage, because that's not what Texas does, and pass an ERPO. That's what the Giffords Law Center recommended Texas to do. Well, it turns out that in 2025, as we just reviewed, and went to Houston after the Austin State Capitol meeting, that there was no significant gun legislation this year either. So F may have to be continued, at least for Texas. But what about the A states? And they actually distinguish between A and A minus. I'm not going to go through these, but there are multiple
Yes.
suggestions to get from B to A, or A minus at least. And you can read these. What are there? 7 on this list? 7 more on this list? Ban
Okay.
open carry, ghost guns. And guns.
No, I'd like him to fix it.
There's another 7 more, 8 more actually in this case. And finally, 5 and 6 more. So there are a total of more than 50 suggestions to improve gun violence and death. Well, 50, we can't deal with 50 at once. We didn't even deal with a single significant legislation in the state of Texas this year. So I'm going to pick 5 priority solutions out of the 50. I hope to be able to do that in the remaining time. Here they are. I'm not going to read each one. I'm just going to let you see them for the moment. And I'm going to review them in reverse order, starting with violence prevention organizations and finishing with this one, because that has the most striking evidence, which I've recently completely been impressed with and appreciate. So let's start with the bottom one: national integration and unification of all those organizations that are trying to do something about it. That's number 5. Well, here are 150, actually 160, I think, here, with the primary ones up there, including Everytown, Moms Demand Action, Brady Center, Giffords, and then the Violence Policy Center. But there are all kinds of other institutions. In the first 2 columns, they are dedicated to firearm violence reduction and prevention. These are other coalition members, meaning that they joined in the effort, but they have other responsibilities too. They wrote a letter along with these organizations to the previous president to include in his State of the Union address the issue of gun violence, which he did. So we've got over 150 organizations. They are not organized. They're not unified. They're not coordinated. That is a very significant problem and needs to be accomplished. And yeah, Mike Newman and others in Washington, D.C. are working on this right now, along with Honorable Ann Brown, to coordinate this. And we've got to accomplish that. That's number 5, but we should do it. Number 4 is adding guns, as Honorable Ann Brown has suggested over the years, to the Consumer Product Safety Act. The Consumer Product Safety Commission, when she was in the cabinet, was appointed as one of her accomplishments, has jurisdiction over 10,000, more than that actually, types of products that we can buy, use at home or in our neighborhood or with our children or family and so forth. And they range from cigarette lighters to lawn mowers and everything else in between. 10,000, but it doesn't include firearms. How did that happen? Well, this was reviewed by the Baker Institute at Rice University at their annual meeting in 2023, and strongly recommended after all the evidence of why that should have happened. But it hasn't happened yet, two years later. And here's the URL for that meeting if you want to come back to it. So number 3, minimum purchase age to obtain a firearm and own it, and the type that you can purchase at that age. We presented this, and here are some of our colleagues, co-authors, including Sandra McKay at Rice University Baker Institute. And we covered that. I'll show you just one brief view of it. Here's data we showed. This is the 22 states that have a minimum age of 18 to buy any kind of firearm. And there's our 95% confidence interval in the firearm suicide death rate in 18 to 24-year-olds. This is not 10 to 24, but it's 18, as we used 18 as the age of 18 to buy a firearm in these 22 states, including Texas. In the 13 states in the District of Columbia that required 21, but at least for handguns, notice how much of a decrease in the firearm suicide rate in 18 to 24-year-olds. Highly statistically significant. It's probably 0.00001 or 0.000001 because of the 95% confidence interval so far away from the other one. But that's true even for those states, of which there are 9, that require 21, not just for handguns, but for all firearms. Statistically significant reduction. And if I summarize this, in comparison with age 18, states that required age 21 for purchase of a handgun, in their 18 to 24-year-olds, the suicide rate was 43% lower. And if it was in the states that required 21 for all firearms, long guns and pistols, handguns, revolvers, it was 20% lower and statistically significant. So we recommended in that resource and publication, which was recent, this summer actually, this recommendation strategy. Now here's one that's even more impressive and difficult to understand. Why would a federal assault weapons ban help the suicide rate by firearm in 10 to 24-year-olds? Let's look at the data first. Because we did publish this, I can't review it all, but you can refer to it. It's in the JNMA, and there's the full reference from its October 23 publication date. Here is in that report the annual, starting with 1980, firearm suicide rate in 10 to 24-year-olds. Was continuing to go up until this year, 1994, 95, and then it went down, and then it stopped going down at this point, 2009, and went back up. This is for the United States, not just for Texas. But if we look at, let me go back for a minute. Okay, so what happened that took 0.9 annual % increase to change it into a statistically significant negative 9% per year? There's the significance. All of a sudden, in this year. Well, the obvious point about it is even in these firearm suicides of 10 to 24-year-olds in the United States, it had something to do with the federal assault weapons ban, which ended in 2004 and began when this change occurred. And after it ended, a few years later, it reversed. So in the age group of 10 to 24, the firearm suicide reversals during and after are correlated with the federal assault weapons ban. That's striking, and it was published. Now, if we look at Texas in red, Texas started with a higher firearm death rate in the age group, but it was continuing to go up. And then, same thing, as soon as the federal assault weapons ban was available in the state of Texas or required in the state, it went down even more strikingly and merged with the country, the nationwide rate. And it stayed down a little longer, but then it came up at an even faster interval at 10% per year compared to 7% for the country. So if anything, in the 10 to 24-year-olds in Texas, the firearm suicide trend is even more correlated with the federal assault weapons ban. So what happened back then, 2-3 decades ago, from 1994 to 2004? Well, it turns out it didn't have anything to do with these other methods of death, whether it was other suicides, not by bullet, motor vehicle accidents, fires, burn, and accidental suffocations, accidental poisonings, overdose, and substances, falls, environmental causes. None of these were correlated. They don't show anything like this. In fact, they were almost all of them just go steadily down. And that's in that report in the JMMA from October of 23. And I was asked to look at Bexar County because some of you are in San Antonio right now. And if we look at the United States and compare it to Bexar, you've got even more of a problem than Texas, which is now shown in the solid curves as opposed to Bexar County. The state major metropolitan area is even worse off than the rest of the state. A problem for you all there, if that's where you're sitting right now. I've got one more perspective on this. 10 states and the District of Columbia did, since the ban ended in 2004, pass their own laws to ban assault weapons. And here they are, one in the middle of the country and the others on the eastern and western ends. And here they are mentioned. If we compare those 10 in the District of Columbia with those that didn't, here is those that did not. These are all the other 40 states. They had no ban since 2004, at least as of 2021. There may be one or two that did pass it, but that's what I have information on. Notice that the increase, like the rest of the country, without a ban is expected. But those that did institute a ban, of which 5 did it right after or continued the federal assault weapons ban in 2004, and the other 5 instituted a ban sometime after that. But notice when we put all 10 together, there was hardly any increase. I was surprised to see that. Hardly any increase in the 10 to 24-year-old firearm suicide rate. Minimal increase, but continuing or resuming the ban. If that's not evidence for a benefit of the ban, no matter how you understand it, I'm not sure what could be. So let's go to the federal assault weapons ban. This plot now shows the annual number of guns manufactured in the United States or imported to, because once the country couldn't manufacture the guns after the ban, they imported them from other countries. But if you include the ban, the guns that were imported, here is the total production of those firearms. Yes, it did stop going up because the ban occurred, and then it started going back up after the ban ended. That was for long guns. If we just look at the handguns in red, if anything, they went down even more during the ban and then went up more rapidly afterwards. How could that be? because the assault weapons ban included any firearm that could be converted into an assault weapon, and that includes pistols, which if you haven't seen the video, how easy it is, it can take a revolver or a handgun and convert it into assault weapons that can shoot as many as many bullets you put in the armamentarium as you want to, as you can, as fast as a assault weapon, dozens in minutes or seconds, even faster than that. And if you look at the statistical analysis, this was all statistically significant. 70% increase after the ban ended in the handgun manufacturing and importation. They didn't have to import it anymore because the ban ended. So handguns were definitely affected by the assault weapons ban. And if you think most suicides, especially young people, are done by handgun instead of trying to do it with a long gun, you have to understand that the ban did reduce the handguns. But 20% of all the suicides in 10 to 24-year-olds, I'll repeat that, 1 in every 5, 20%, are done by a long gun. They can use a long gun to suicide, whether it's a rifle or a shotgun. And if it's an assault weapon, they're probably going to suicide something else than themselves. And I can have Roberto talk about how the exit looks when you use that as opposed to a non-assault weapon. So it's apparent that the federal assault weapons ban reduced handgun prevalence even more than long gun prevalence. If you look at the red and assume that's available handguns as opposed to the black of available, accessible long guns. Okay, I'm going to finish with number 1. Number 1 is child protection laws to prevent or to require secure storage. Thank you again, Honorable Ann Brown, because this is impressive as I have seen the data. That's why I've saved it. Firearm suicide rate in the 10 to 24-year-olds, age adjusted, versus household gun ownership. These data come from the RAND Corporation. So households that have 15% in the state, these are by states, by the way, so there are 50 states in the district, and states, yes. But if you have 15%, this is the annual firearm suicide rate in the 10 to 24-year-olds. If you have 70% or close to it, it's up here. The linear regression of all these 50 dots is 10 to the minus 0.00000000000, 15 zeros. It's incredibly statistically significant. It's 1 in a billion chance of not being fact or truly related. And there's the ANOVA value, F value. That's about as high as I've seen. Linear regression, credible. This is hard to believe, in my opinion. But if you do an exponential regression, that's this solid line, the relationship is exponential. So you get a far more increase in the suicide rate in 10 to 24-year-olds with a higher percentage of household gun ownership. I want to go further with this and look at Texas. You are average. The state is actually not where I thought it would be. It's the average. So some accomplishment there. But if we look at males versus females, what I just want to show is that this curve, if there's anything, goes up faster. It's more exponential. It's steeper here than the males. So females even have a higher relationship, although the statistical significance, because they're wider spread in this, isn't greater. But the steepness of the exponential curve suggests that girls, females, between the ages of 10 and 24 are even more vulnerable to the guns at home, the percentage of homes that have guns. Their exponential relationship greater in them than in males. Again, Texas is average in both males and females. Now here's another metric. It's called as a firearm prevalence proxy. In other words, how many or how accessible are firearms. As a proxy, we use the proportion of all suicides that were by firearm. So the more firearms available, the more likely a suicide can be accomplished and be deadly, because 95% of suicides by firearm are, as opposed to a much lower level by knife, by wrist cutting, and so forth. So this proxy is used by many experts. And if you use that as the X value here, proportion of suicides by firearm from 20% to 80%, you again get an exponential relationship with highly statistically significant linear relationship. So here's another support of the other proxy I just showed of the percent of homes with firearms. Now there's even another way to go for that. Let's just jump ahead for a minute. And that is handguns versus long guns that are permitted after the firearm store has to get a background check in order to allow the purchaser to have that firearm. It takes several days now, even a week, to be double checking on the firearm background check. But if the background check turns out to be valid, and that the person's not at risk of killing somebody else or has a criminal record or already potential homicide of a spouse or partner and so forth, that is now permitted to buy a handgun or long gun. And so what I'm showing you here is the permits from the background check to buy handguns. And again, you see in males and females, even more so in females, that the permits allowing the purchase of handguns after the background check shows the same relationship with the firearm suicide rate in 10 to 24-year-olds as the background check for handgun permit approval. For long guns, it's even more related, or at least it's more steep in terms of the exponential relationship. So long guns are also correlated in terms of their prevalence based on the permit rates of the background checks. And this is, again, for the entire country, but it's the age of 10 to 24. So these data are hard to imagine. And if there's anything that we should do, it's this number one. Secure storage is required by law in the states. And I would add, although reluctantly, to prevent firearms from being purchased in the first place, reduce the number in homes by preventing them from being purchased. And if they're in the home, buy them back and reduce the number of firearms, as has been successfully in Australia. And they haven't had, except for one instance, a mass shooting since they did that 20 years ago. Buy back the firearms and let the owner have several $100s more because they were willing to return them. So finally, and overall, and then I'm done, sorry the extra time, we have to do a better job educating ourselves and everybody else, especially the children and adolescents who are in schools where they can learn from the teachers, and the educational program is a requirement by the state about firearm risk, danger, management, storage, especially if they come from a home where they exist. And the parents think they don't know how to get or where the firearm is stored or open it up if it's in a safe. And they're wrong in most cases, has been demonstrated by more than several studies. Parents are wrong about that among the gun owners more often than not. And then our teachers learned how to do this in elementary, middle, and high school. By college, it's almost too late because they're already 10 to 24. And then throughout the medical training profession, students, interns, residents, fellows, physicians, and our other healthcare professionals and providers, they need to educate. And so do the firearm owners. They need to educate their colleagues, their families, their children. But that's been the most difficult of all. We can do the others, I think, more readily. The Baker Institute's had, in the last week and a half, 2 conferences on this. Educate, educate, educate. Because science is at risk because of the reduced funding. And then a few days afterwards, science is under siege, the anti-science, which is abundant. There's even more anti-science than science now being reported, including in medical journals. So let's stop here and let you ask. I'm sorry I took so much time, and have you share whatever may be in the chat with me, and I'll leave this on the screen for the time being.
Thank you so much, Archie. That was very educating and enlightening and compelling.
And to some extent depressing.
Absolutely, absolutely. So we do have a couple of questions in the chat. Paula, do you want to tell us what this Dr. Ludwig's question is? Okay, so here we go. Dr. Ludwig is asking that the states that ban assault weapons, was this ban on possession of the weapons or the sale of the weapons?
Both.
Which was it?
It was a ban on existing assault weapons not being shared or stolen or moved to other owners. But the primary was the ban on the availability of assault weapons, including manufacturing within the stores that sell firearms. The ban was widespread. Unfortunately, as I tried to relate, when it was coming toward the end of the planned 10 years as a law, federal law, and the data were being analyzed by both sides, if you want to consider this as a bivalent issue, the evidence wasn't so clear, and it didn't make enough of a difference to the Senate and the House in the government and federal government to continue the ban. It's been in retrospect that we found so much evidence for not only benefit but for prevention of the problem of increasing firearm violence and suicide. So this is all retrospectoscope, but it's pretty impressive, and why we published that article. And we need to look at it again. Meanwhile, individual states have realized this, and they have had the ban instituted, as you saw, and some did it by keeping it in place back then in 2004, the 5 that did. And those data stand, I think, hard not to accept. Those states are saving lives of their 10 to 24-year-olds and older persons. They are also potentially saving younger lives than age 10 because, as we've reported, and the co-authors, who I'll show in a few minutes again, have accepted, is that the increasing firearm unintentional accidental death rate between age 1 and 7 has increased more rapidly than any other cause of death in the United States because of the prevalence, availability within homes of these children, or when they go to another home to visit their neighbor child, that home has that gun and they're playing with it and they kill themselves accidentally, or their colleague, their neighbor, their friend, their playmate, as young as the age of 1. Even infants have died because of a sibling or a neighbor who was over. So that's another issue, the firearm accidental death rate. But the ban had some benefits there too.
Yeah. So in terms of small children, particularly who have access to unsecure firearms, we all know that there is a huge movement to educate parents about responsible gun ownership. And we have with us Lisa Ross, the founder of Locked Arms for Life in Austin, who distributes gun locks and materials that educate the public, the parents, about how to keep their guns safe. Thank you, Lisa, for attending. But my question is, in terms of secure storage, what's the evidence that secure storage actually makes a difference? I mean, it's logical to think that it does, but are there any studies that show that?
While I get the slide up, Anne, could you answer that question too? Because you've already provided a lot of help to have owners have safety mechanisms. So I'll let Anne answer part of that while I put this on the screen. And maybe she can't, oh, there you go. Hey, Anne. Now you gotta unmute. Hey, you look like that photo that you showed us of.
Okay.
Yeah,
Lisa,
she's
would you
having
like to
trouble
comment?
unmuting.
I think Lisa.
While she's coming to unmute, yes, we we don't really have statistics or stats, if that's what you're asking. That's the main question that sounds like. But what we do offer is an educational book for children, 3rd through 5th grade, that talk about safe gun storage so that schools, administrators can actually start having a conversation. Here in Austin, we have our children's book in 70 of the elementary schools. And even right now, we're working on putting together a program, or I guess a toolkit that teachers can use, because we have a librarian that was in the school district that actually educated children, read the book to them in the library, and then she put together a study plan with the kids, got permission from the parents to educate on it. And it was a way for the kids to have a conversation and the librarian to actually educate them on safe gun storage. She's going to do it again this year. And so we have her, and then we're putting together a toolkit that we hope to extend to every librarian in the city of Austin, so that they can all duplicate what she's doing, so that the education. The big key you said is educate, educate, educate. We believe that 100%. Again, too, we not only give away gun locks, but we give away lock boxes. Once a year, we do a big safety fair here. And for the last 2 years in a row, we've given away anywhere from about 100 to 150 lock boxes that we give out to the community to talk to them again about safe gun storage. We educate to make sure we have at Baylor Medical School, we do a program that we educate first-year medical students on how to talk to their future patients about gun safety. What does it look like, and what is it? We take a very safety approach to it, based on same thing as like bicycle helmets and life vests. We tell people what's the most important thing they can do to protect their families from gun tragedies. What we don't do is we don't tell them where to swim. A drowning prevention group does the exact same thing. They hand them the life vest, but they don't tell them where to swim. And we do that same kind of approach when we are educating the community about gun safety. Because again, I don't live in everybody's homes. I don't know what their practices, non-practices are, but we do know what the best practices are. So we can share that information with everybody out there.
Anne's unmuted herself.
Sorry. Yep, and go ahead, take over.
How much have you
But
spent
there's
doing
also
this?
there's also a JAMA video that was released. I've actually got it in one of my slide presentations, but it is a JAMA
Yes.
thing that shows that just a 2-minute video about safe gun storage can change even a perspective of children. And I've got that information. Like I said, I've got it in our slide presentation that we actually do with a lot of folks.
That's
So
superb. That's absolutely superb. I knew about that video. And
Yeah.
the problem is how to get it around,
Yeah.
how to make it accessible. And you are doing exactly that. So good for you.
Well,
And how have
yes.
you helped provide safety locks and the like? What have you done about that?
Well, we worked with a group who in different on different dates in different areas gave out safety locks free to people. And they would have a certain day and announce it. And this was done in the 10 places that had the highest death rates from children grabbing guns and shooting, or shooting because they were anguished at school about something. You know, this is by making it accessible, it's really very dangerous. Anyway, the we have having people getting free gun locks, and that is done on to at the most the place that has the worst problem, and those are given out free on several days, and it has been highly successful.
Yeah.
You've
Thank
done
you,
way over
Lisa.
$100,000 worth of donations so far. But look on the screen and you'll see in the lightest blue color those states that have no gun storage law, and then the most blue states like Oregon,
Mhm.
Massachusetts have secure laws required, especially when the gun is not in the owner's possession. And there's also these blacker, darker blue, I guess, law if the child is likely to access an unsecured gun. So if we take the panorama, which goes from this blue to hardly any blue, and look at the data, here's the evidence. I didn't show this before. The evidence is pretty straightforward. Here are the 19 states that have no gun storage law and the 10 states that only have it if they give it recklessly or intentionally to a child. And yes, they have in the 10 to 24-year-olds a 7 deaths per 100,000 of that age group per year during 2022, 2023. But if they have a law, especially the better law possible, notice how it dropped. It's half the rate of the states here at 3.2 versus 7.2 or 3 or 4. Just because they have the law, well, the question of cause and effect is the issue, but in association with the law, these 7 states are saving half as many lives, I mean, twice as many lives.
Twice, yes.
There's evidence.
Yeah. Yeah, that's definitely confirmatory of what we are talking about, the need to have safety, gun education, even if it's laws in the states, because somehow they reach the households somehow. Why don't we let Dr. Rudy Morales ask his question? Rudy, do you want to ask your question?
Okay,
Are you
yes.
there?
Yeah, can you hear me?
Yes.
Okay. Yeah. So this reminds me of the legislative efforts to expand Medicaid many years ago. We went to Austin, presented facts and the importance of investing in preventive care and expanding access to care, and all of those facts and all of those trips and testimonies to Senate hearing committees didn't accomplish anything. My question was just what other strategies can we use that have been proven to be effective, that are evidence-based, aside from getting people to vote, which in Texas has always been a challenge.
Okay, one thing we can do is look at the Affordable Care Act, which was enacted in 2010, and after which very significant death reductions occurred depending on the cause of death. I've done the cancer data and we published some of that. That if in fact, we have a second publication coming out, that as a result of the Medicaid coverage from the Affordable Care Act, the death rate from cancer went down. Not only that, the incidence improved in terms of detection. So we can do the same thing, and I've done some of it from 2010 forward for the benefit of Medicaid and Medicare because of the Affordable Care Act. Now that the big beautiful bill, blah, 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 has eliminated in many cases Medicaid accessibility because of the requirement to be at work and others technical issues. Now we got to worry about the Medicaid issue again, increasing this and making our challenge even greater. But we can track that prospectively in terms of the data. Will Medicaid reduction not only cause more firearm deaths, but also more cancer deaths, more heart disease death? And we can do that prospectively. I don't want to have to do it that way because having to wait to see what's going to happen is unacceptable.
Yeah.
Thank you.
Okay. So let's look at the chat. Do you want to make a comment on Dr. Ludicki on your question?
Can you read the question? I'm not able to.
So I just said that I was extremely impressed that the assault weapons ban in the states that chose to do it after the federal ban had expired, that even though it specifically prevented the sales of new assault weapons, so that meant there were lots of them still out in the public,
Yeah.
it was extremely impressive that this decreased deaths so much. This is the first data I've seen that impressed me enough to say that a federal assault weapons ban, so it applies to every state, would be very, very significant in preventing large numbers of death. And I appreciate your work here.
And I was emphasizing that the states should do it while waiting for the national government because it's not going to happen the next 4 years.
Sure, sure, I understand that.
Good
And
guess.
so individual states can do it and make a huge difference in their states. So that is a wonderful thing. I appreciate you presenting the data.
Thanks,
Okay.
Roberto.
All right, so we are at the hour. I would like to thank all of you for joining us today, and Dr. Blair in particular for his, as usual, excellent and eye-opening presentation.
I've been asked whether it'll be available to review later.
Excuse me?
Will this be available to be
Yes,
reviewed
yes, it's
later?
going to
So-
be the presentation. The recording is going to be available in our website, www.texasdoctors.org, and also in our YouTube channel, which you can also find under the same name. So
Oh,
thank you all. Hi,
I'm
Dr.
Michael,
Hi, Dr.
one-
Newman.
One question because we're over time.
Sure.
Michael,
I just walked in the door first thing because I was downtown all morning, the first time I got back. But I was interested in the data that was just expressed about the assault weapons benefit. And I think the legacy of the assault weapons goes back to the Reagan administration. And so that was a Republican issue, and I don't know what that whether that's something today that's going to make a difference or not. We'll have to see.
since we've
But
run
the
out of
data
time,
is important.
Mike, since we've run out of time, we're going to pick up on that next time because I have data on that, and we should look at it too. But we're over the hour, and we're trying to record this.
This was recorded, so I can I'll get access to the recording.
Yes,
Yes.
you can. Yes, you can. Again, on our website or on our YouTube channel, Texas Doctors for Social Responsibility. And it's good to see you, Dr. Newman.
So, Michael, all right. So I want to catch up with you and Archie after this, and I appreciate the comments of Dr. Ludke.
Okay. Again, thank you all, and have a good rest of the day and an excellent weekend.
Thank you.
Thank you.
Thank you for your good work.